In this podcast episode, Dr. Thomas Seyfried, a professor of biology at Boston College, discusses his groundbreaking perspective on cancer as a metabolic disorder rather than a purely genetic disease. He explores the roles of diet, exercise, and metabolic therapy in cancer prevention and treatment, emphasizing the importance of lifestyle choices and individualized approaches to improve patient outcomes. Dr. Seyfried presents a compelling argument that challenges the conventional understanding of cancer as primarily a genetic disease. He emphasizes that cancer is fundamentally a metabolic disorder, driven by lifestyle and environmental factors rather than solely by genetic mutations. This perspective is particularly relevant given the alarming statistics surrounding cancer, with nearly 2 million new cases diagnosed annually in the United States and approximately 1,700 deaths per day. Dr. Seyfried highlights the global nature of the cancer epidemic, noting that the American Cancer Society projects a continued rise in cancer deaths. He critiques the medical establishment's focus on genetic factors, arguing that this approach has not led to significant advancements in reducing mortality rates. Instead, he points to historical evidence suggesting that cancer was rare among traditional African tribes, indicating that modern lifestyle changes, including diet and physical activity, play a crucial role in cancer prevalence. Central to Dr. Seyfried's argument is the idea that all cancers share a common metabolic dysfunction. They rely on fermentation for energy production, which occurs in the absence of oxygen. This reliance leads to the accumulation of waste products like lactic acid and succinic acid, contributing to the inefficiency of cancer cell metabolism. Dr. Seyfried references Otto Warburg's research from the 1920s, which demonstrated that cancer cells consume more glucose and produce less energy through oxidative means compared to normal cells. Dr. Seyfried's research journey began with a case study involving children with brain cancer treated with a ketogenic diet aimed at lowering blood sugar levels. His findings indicate a direct correlation between blood sugar levels and tumor growth rates, reinforcing the notion that high blood sugar accelerates cancer progression. He argues that cancer cells' dependence on glucose and glutamine for energy makes them particularly vulnerable to dietary interventions that restrict these fuels. To combat cancer, Dr. Seyfried advocates for metabolic therapy, which involves dietary modifications that promote the use of ketone bodies and fatty acids for energy instead of glucose. The ketogenic diet, characterized by low carbohydrate intake and high fat consumption, can help individuals enter a state of nutritional ketosis, creating an unfavorable environment for tumor growth. Dr. Seyfried emphasizes the importance of monitoring the glucose ketone index, GKI, to maintain a low GKI, which can serve as a quantitative measure of metabolic health. In addition to dietary changes, Dr. Seyfried underscores the role of exercise in cancer prevention. Physical activity lowers blood sugar and glutamine levels, which are fuels that can drive cancer growth. He draws parallels between modern sedentary lifestyles and the active lives of our Paleolithic ancestors, who had lower obesity rates and higher energy levels, suggesting that their lifestyle contributed to their lower cancer rates. Dr. Seyfried challenges the somatic mutation theory, which posits that mutations in the nucleus lead to uncontrolled cell growth. Instead, he advocates for the mitochondrial metabolic theory, suggesting that mitochondrial dysfunction is the root cause of cancer. When mitochondria become defective, they produce reactive oxygen species, OS, that can cause mutations in the nucleus, but these mutations are often secondary effects rather than primary causes of cancer. This perspective shifts the focus from genetic changes to the underlying metabolic dysfunction that drives cancer development. Dr. Seyfried acknowledges the resistance to changing the prevailing view of cancer as a genetic disease, comparing it to historical paradigm shifts in science. He believes that the current cancer research paradigm, which focuses on genetic mutations, is deeply entrenched and resistant to change, despite evidence supporting the mitochondrial metabolic theory. He calls for a reevaluation of cancer research priorities and treatment strategies to better address the root causes of the disease. Dr. Seyfried advocates for metabolic therapy as a more holistic approach to cancer treatment and prevention. He suggests that this therapy can shrink tumors and improve overall health, allowing for better surgical outcomes and reducing the likelihood of recurrence. Unlike conventional treatments, which often focus on managing tumors, metabolic therapy addresses the underlying metabolic dysfunction that contributes to cancer growth. Throughout the podcast, Dr. Seyfried shares various case studies that illustrate the potential effectiveness of metabolic therapy. He recounts the story of Pablo Kelly, a patient with glioblastoma who rejected conventional treatments in favor of metabolic therapy. By adhering to a low GKI and a ketogenic diet, Kelly managed to survive for over 10 years, far exceeding the typical prognosis for his condition. Such anecdotes highlight the potential for metabolic therapy to extend survival and improve quality of life for cancer patients. Dr. Seyfried stresses the importance of individualized treatment plans when implementing metabolic therapy. While the ketogenic diet may be beneficial for many cancer patients, it is essential to tailor dietary interventions to each patient's specific needs and circumstances. He encourages listeners to consult with healthcare professionals knowledgeable about metabolic therapies to ensure safe and effective implementation. Fasting is presented as a powerful tool for achieving nutritional ketosis. Dr. Seyfried acknowledges that while fasting can be effective, it is challenging for many people. He suggests a gradual approach to fasting, such as starting with a zero-carb diet for a period before attempting longer fasts. He emphasizes the importance of individual experimentation and monitoring to find the best approach for maintaining metabolic health. Dr. Seyfried highlights the emotional impact of certain case studies, particularly the loss of patients who have shown remarkable resilience and improvement through metabolic therapy. He notes that family support plays a crucial role in the treatment process, as families working together often see better health outcomes. This underscores the importance of a supportive environment in the journey toward cancer management. Throughout the discussion, Dr. Seyfried addresses common misconceptions about the ketogenic diet, particularly concerns about nutrient adequacy and potential adverse health effects. He counters these concerns by explaining that a well-formulated ketogenic diet can be nutritionally adequate and that many patients report improved energy levels and overall well-being after making dietary changes. Dr. Seyfried expresses optimism that scientific evidence supporting metabolic therapy will eventually gain recognition, leading to a paradigm shift in cancer treatment. He believes that the truth about metabolic dysfunction in cancer will emerge, and people will begin to understand the importance of metabolic health. His hope is that more patients will explore metabolic therapy as a viable option, despite the challenges posed by traditional medical practices. Dr. Seyfried's overarching message is one of empowerment, urging individuals to take charge of their health and explore alternative therapies that may offer better outcomes. He believes that the scientific community will eventually recognize the validity of metabolic therapy, leading to improved treatment options for cancer patients. By focusing on lifestyle choices, dietary interventions, and metabolic health, Dr. Seyfried advocates for a more comprehensive approach to cancer prevention and treatment.